Hi, I'm Dr. James Nill of Nill Family Chiropractic and Wellness Center, and today we're going to talk about neck pain. Now, there's different causes of neck pain. A lot of times when people get in car wrecks, it's called whiplash. What happens is the neck goes backwards as the car gets rear-ended, and the muscles can't have to guard and contract to keep the neck from going back so far, so it strains the muscles. And if it gets past the muscle strain, then it sprains the ligaments that are down deep, and there's a different kind of pain for each of those. Other causes of neck pain that we're going to talk about today. One of them is just a muscular imbalance, which causes a differential in curvature in the neck, and that can have anything to do from having flat feet to just a posture imbalance, like working at a computer wrong or bending over too much and things like that. Also, it causes a dysfunction within the facets, which is a little joints in between each vertebrae, and that can cause the pain in there. Another thing could be is arthritis, which can cause a little irritation in there, and if you get too much arthritis, it could actually pinch on some of the nerve roots, and that's where you get radicular pain. And the other one that I'm going to talk about is disc herniation or disc bulging. In between each vertebral body, there's a little bitty thing called a disc, and it helps shock absorb the spine as you go through the day. So what happens is if that disc gets disrupted, it can bulge out and pinch on a nerve root, which causes that pain to go down the arm. The first thing we're going to do is we're actually going to use moist heat. This heat's a little bit better than drier heat because it actually gets in a little bit deeper in here. So I'm going to have the patient lie here with the hot packs on for 8 to 15 minutes, depending on how long we need to do heat up. Sometimes when the neck pain, as we have a lot of tense muscles in there, we have to use a little bit deeper heater source. This is called ultrasound therapy. It's a little bit different than it's different than the ultrasound that you get when you go to your gynecologist, because what it is this is actually a deep heater, different frequency, and actually the ultrasonic waves will go down deep and then reflect off the bone structures at the bottom, and it'll get the deep musculature heated up, and that frees up a lot of those spasms, which makes the adjustment more effective. So we just do this. We put the ultrasound gel on here. Swirl it around the neck, and we do this from 8 to 15 minutes. Sometimes when we do manipulation, some people have really arthritic spine, some people just do not like manual manipulation, and sometimes I just can't get some things to go. So another thing we can do is actually use activator therapy, which does the same thing. What it does is it sends a quick mechanical impulse into that joint, stretches the muscle, sends a signal up to the brain, which sends a signal back, and it releases that muscle tension instantly. So I feel for the restriction. I go in here. Depending on how bad the restriction is, that's how many times I do it, and I always feel afterwards to make sure I got it done. Okay, some patients that have degenerative disc disease or disc herniations where the vertebrae are closer together due to the disc not being there, it causes the foraminal holes on the side where the nerves come out to be smaller. So what we want to do is we want to try to do a little traction, and it'll take pressure off of there. So one of the techniques I use is called towel traction. And what we do is we just kind of pull up a little bit. We hold for about 10 seconds, and then we relax and rest for about 5. And we do that about 10 times. So the next thing we want to do is we're going to actually do some manipulation down in here. So I'm going to feel for the joint restrictions, and there's a few right in here. So what I'm actually going to do is just going to keep her nice and calm. Now actually, when I do my manipulation, I'm just flipping my hand like this. I'm not actually pulling the neck around. A lot of people get scared, like Steven Seagal or something like that, where people are twisting the heads real fast. No, we are really cautious because all we're doing is pretty much going like this. But I have to rotate the neck a little bit so that way the facet joints will slide easier apart of each other and the muscles will work a little bit better. So let's do another one on this side. Again, you might hear noise. Just goes like this. Notice I'm just going like that for the most part, and that's what causes the release. And then I feel again, and the tension's gone, and the pain's instantly gone.